it's impossible to continuously rebuild the wheel. We don't have enough time, we don't have enough financial resources. So if we work together, if we share information and we do that in a way that is secure and governable, then we can actually get to the solution that impacts lives faster. And so it's that connective tissue, it's that backbone that we've spent so many years building. And one of our biggest projects right now is in multiple sclerosis. It's been 10 years in the making. And to rebuild those relationships and to rebuild the trust that we have with some of the patient populations that we engage with, that doesn't happen overnight. And I think that Nashville has such a great recipe of culture and technical capability and expertise, particularly in healthcare, that it deserves to be on an international stage. And we deserve the opportunity to replicate that and then also transfer what we learn from other innovation ecosystems into our community to build the flywheel, build the two-way connections that continue to advance patient outcomes and save healthcare money.
It's got to be very interesting to jump between the various countries, the perceptions of healthcare, how to navigate patient conversations and fluidity. What's been your secret sauce for taking the perspective of the English with how they receive health, how they approach health, with how the US navigates healthcare? Any thoughts there on just navigating those different cultures and even how healthcare is provided?
I would say that our similarities are greater than people might imagine. And where we're different, we're not very different. A lot of the same problems that we're trying to solve in the US, they're trying to solve for too, and sometimes with less of a budget. And one of the things that's really cool about the Global Health Connector is it's not only looking at really wealthy countries, it's also looking at countries that are struggling to make ends meet, and they're finding ingenious solutions to some of the common healthcare problems, whether it be in the UK, the US, or Africa. And so I think that's an opportunity to spotlight those ingenious solutions and then have that come into our world here in Nashville and actually make lives better. One of the things that I've learned in this process, particularly in the UK, is always focus on the business understanding and how you're going to deploy it, how you're going to operationalize it, and do that as early as possible. Otherwise, you'll just be spinning your wheels for many months and wasting a lot of money.